All right, Laurie, you there?
I'm here.
Okay. Hi, everyone. Thank you for joining us for this session on the Radiology Concierge Service. My name is Reed Humphrey. I'm the Vice President of Technology Consulting for Canopy Partners. I'm joined today by my colleague, Laurie Shoaf. She is our Radiology Concierge Services Manager. And we're going to discuss an innovative program that can help your hospital or health system dramatically improve productivity, efficiency, as well as physician satisfaction. So we've designed this session to be interactive and built in several breakpoints and some flash polls to try to get some feedback from the audience. So hopefully you'll engage with us. We look forward to it. And with that, let's get started. So our learning objectives for today are, we have several. We want to define the problem and solution that we're trying to address. We'll explain what a concierge program is and how to build one for your hospital or health system. We'll discuss the people, systems, and processes required. We'll go over a case study in North Carolina with some metrics and results that we've seen kind of before and after performance. And we'll also talk about, take some Q&A. So those are our objectives today, and we thank you for joining us. And just a quick high-level overview of a radiology concierge service. If you're not familiar with this concept, it's a concept where you have an outsourced call center that is taking calls and administrative tasks off of the radiologist. At Canopy Partners, we have put this in place for organizations across the country. We serve about 150 radiology organizations in 30 states. And sometimes it might be the hospital that wants to put this program in. Sometimes it's the radiology group. And sometimes it could be an outpatient imaging center. So it kind of varies in terms of who the client is, but the general purpose and concepts that we're going to share with you today are applicable to all. Our team is always looking for ways to innovate and provide new value for our clients. And in this particular program, it improves radiologist productivity in the range of 5 to 10%, which means that you can save every rad in your organization about 3 to 6 minutes per hour. And more importantly, it dramatically improves the accessibility, the quality of care, and it enables the right study to be assigned to the right rad at the right time. So we will jump into this and talk about how this program came about. Again, it is an outsourced call center that supports radiologists in all the various communication and admin tasks that might impact their daily workflow. The problem we're trying to solve is radiologists today are dealing with a myriad of administrative and compliance burdens, many of which have come about in the past few years. Rads are being asked to do more with less. They're having to serve multiple customers, hospitals, referring physicians, patients. They have to provide more clinical documentation for things like MIPS, MACRA, appropriate use. And they oftentimes deal with frequent interruptions and distractions to their reading workflow. So based on physician demand, we had radiologists come to us and say, we need some help in just getting these administrative kind of ankle-biting things off of our plates so that we can focus on practicing radiology at the top of our license. And we feel that it's important that a radiologist should always be asking themselves, what is the highest and best use of my time right now? And that's what we're trying to help them focus on. If you remember the old analogy from Stephen Covey several years back, it's a great video. You can find it on YouTube. It's probably 5 or 7 minute video on the big rocks analogy, but I'll share it with you in just a few seconds here. Basically, if you look at these two jars, the jar on the left of the screen, should be on the left of your screen, was filled with sand first. And then whoever was filling the jar went back and tried to fill it with bigger rocks. And they don't all fit in the jar because once you put the sand in first, it's very difficult to get all the big rocks into it. So the analogy here is that some important things could be left out of your day if you try to start by filling your day with the small things, the least important things. But on the right, the jar on the right was filled with the big rocks first, and then the sand was poured into it. It's the exact same amount of sand and the exact same rocks, but when you put the big rocks in first and then you pour the sand in, it can kind of fill around the big things and you can get everything done in the course of a day. So we think this is kind of a great, word picture for what we're trying to accomplish here for radiologists, is taking the sand kind of off of their plates so that they can focus on the big rocks. Very quickly, we told you we were going to do a couple of flash polls in this session. So we'd like to ask, how many of you have a service in place for your radiologist that is an outsourced call center that takes these functions off of their plates? You may or may not call it a concierge service. It goes by different names. But how many of you have a service like this in place for your radiology department? If you'll use the chat feature, just give us a quick yes or no. And if you have a question, feel free to shoot us a question and we'll try to respond as well. We have some people from our staff that are fielding questions via the chat. So just use the chat feature, shoot us a quick yes or no or a question. While you're doing that, we'll keep moving. So we'd like to share with you a case study from North Carolina. This is between Greensboro Radiology, which is a large subspecialized group in central North Carolina, and Cone Health, the major health system that Greensboro reads for. These two organizations are having great success with a radiology concierge program. It's been working for them for about 8 years. And we're going to share with you how they put the program in place and some of the pros and cons of it, as well as the results that we've seen. So first, a little bit about Cone Health. Cone is a 1,300-bed regional health system, has more than 100 locations, including 5 hospitals, 3 ambulatory care centers, 3 outpatient surgery centers, and about 150 physician practice sites. As an organization, Cone performs approximately 700,000 radiology exams per year. On the practice side, Greensboro Radiology is a large subspecialized group with 75 radiologists, 5 physician assistants. The group reads 1.1 million exams. Cone is their single largest client, but they also read exams for other facilities. In total, Greensboro reads for 10 hospitals and about 50 ancillary sites. The group is ranked in the 99th percentile nationally in referring physician satisfaction scores, and leadership believes that this concierge program is a big reason for that. So now we'll talk about the concierge program that GR and Cone have put in place. There are 2 main components of this service. The first is the technology, and the second is the staff that powers the system behind the scenes. On the technology side, we recommend that a practice put in place a smart work list. We use the Clerio smart work list. There are certainly other products out there on the market, but this one happens to meet our needs, and we think it's a great product for this particular purpose. In addition to the smart work list, we have a team of professional radiology assistants, which we call PRAs, and they are there to take calls and document things and record notes and keep things flowing between the RADs and patients and referring physicians and administration. So it's the combination of the technology and the staff that makes this really powerful. We like to say it's kind of like a Reeses Cup. You take the chocolate and the peanut butter, and when you put them together, you get something even better. And when you sprinkle in some new and, even you keep turning the dials and trying to improve it, you even add some Reeses Cups, or Reese's Pieces to the mix. So yeah, we liken it to a Reeses Cup. The key components of the program, obviously we have the staff, we have the smart work list, which we'll talk about more in a moment. You have to have a very robust call center operations that's set up to be able to handle this. You've got to have the right telephone system and the right network in place and the right security. You have to have access to the facility-based PACS and voice recognition systems to be able to see what the radiologists are looking at and be able to facilitate things that they need done. The staff have to have access to the scheduling software so they can see who's working at a particular location and a particular shift. There has to be an access to the communication note tracking. And we also recommend instant messaging, which is a great way just to get a hold of a doc quickly, ask a quick question, or keep something moving forward. So we highly recommend instant messaging. So now we're going to talk about the PRAs, the professional radiology assistants. We strongly believe that the PRAs are the secret weapons behind the scenes that allow radiologists to get freed up and be at their best, rather than dealing with all these phone calls and administrative tasks. Laurie Shoaf is our Radiology Concierge Services Manager. She built this team and leads the team. And Laurie, thank you for joining us today. And I'd like to ask if you could just share with us what the PRAs do and how you think this is beneficial for the radiologist.
Thanks, Reed. I'll be glad to do that. Before diving into the types of services we provide, I'd first like to touch on a key component of a successful concierge team. Reed has mentioned that it's really a call center environment for handling calls. And we also stress that it's very important to have a single phone number for contacts to the radiology department 24/7. This centralized number minimizes unwanted calls and disruptions in the reading room, and it really provides the ability to triage calls from a variety of sources to assure timely turnaround. And an added benefit is that the RADs no longer have to give out their cell phone numbers. So a single point of contact for both internal and external communication provides a number of benefits to a number of customers. For the RADs, it reduces interruptions, both calls and in-person visits by text. It offloads the non-clinical or administrative work tasks, and it allows a RAD to maintain a clinical focus. There are a lot of benefits for techs too. It improves their operational efficiency because the concierge team does all the legwork for them to communicate with the RAD and provide the communication then back to the tech. For referring providers, they receive timely report results and the ease of being able to contact directly with the RAD that they're trying to reach. So we feel the best practice is to publish this single number both internally and externally and remove all other published numbers. And I know that can be a challenge. So the scope of services. Tasks performed by the concierge team can really be rolled up into 4 major categories. And keep in mind that these tasks can vary from one health system organization to another. Critical findings under communication is really kind of right at the top of the list. That's very important to assure timely communication of critical findings. And the PRAs can facilitate that, contacting the RAD directly with the referring physician. Handling urgent and non-urgent findings is also important, and the PRA can facilitate providing that information to the provider's office and then documenting the action taken for the record. One key point I'd like to mention here is the importance of having a central database of phone numbers to ensure efficiency in this. And Reed will share a little bit more about that with you a little later. Exam correction and notification is another component. Common corrections include images and missing worksheets. We've got notification monitoring, such as stroke notification or exam escalation. And PRAs can also assist in monitoring stat turnaround on exam times and then notify the appropriate individual if things fall outside of the expected turnaround time. And fourth, or last but not least, is that facilitating communication. So answering those inbound calls and transferring those calls to the appropriate RAD. Examples here include protocol questions and provider consultations. And we use a number of communication tools, instant messaging. A Clerio has a collaboration feature we use, and then updates within the communication notes themselves. So I'd like to circle back for a moment to a comment I made about 24/7 and having a single contact number for 24/7. Our concierge service did not start out 24/7. We started out weekdays, but we were so successful and had such great customer input that we soon looked for a solution to extend the coverage to 24/7. This was a tricky challenge, and it can be expensive. It's tough to find skilled individuals to work these shifts, and then you have the potential for turnover. So the approach we took was to look offshore. We found a healthcare call center in the Philippines that was willing to provide the services nights and weekends. And this has worked out extremely well for us. We can now afford to have a full-time team of highly trained individuals provide these services 24/7. I'd like to share a couple of testimonials with you that really attest to the success of our service. Dr. Heath McCullough, who's a radiologist from the GR practice, says the concierge service is an absolute game changer. And Steve Schanenberger, who's the executive director of imaging for Cone Health, says prior to having the single phone number, it was exasperating for the techs and providers to communicate with the RADs. This is just a sample of the positive feedback we've received from our customers.
Thank you for sharing that, Laurie. That's great. So we'll stop and take another quick flash poll now. So the question here is, does your practice have a single phone number for contacting RADs? And if you'll use the chat feature, just let us know, yes or no. And again, shoot us any questions you have, and our staff will be monitoring that and responding to your questions. So we talked about the staffing side of things. Now we'd like to talk a little bit about the technology behind the scenes, and we mentioned the smart Worklist technology. The reason that we believe that a smart Worklist is so important is that it accomplishes a lot of things that make a better workflow and experience for your radiology department. First of all, if you use a product like a Clerio, and again, it doesn't have to be this particular product, but it can serve as a unified work list. So it can actually sit over different PAC systems, different voice rec products. It's designed to be a vendor neutral work list. And the benefit of that is if your hospital has more than one PACS in your overall enterprise, this can lay over that as a single work list. Or if your radiology group is reading for more than one hospital, and maybe, you know, their second and third hospitals have different PACS, it allows the radiologist to have a single pane of glass to view and manage their work. Where this plays out is the radiologists are able to then balance their workflow better. So if one facility is really slammed today and the radiologists are kind of getting crushed on the work list, and maybe at another facility, there are a couple of RADs that are not as busy, then the radiology group can shift workflow over to that other facility, which can help them cover and keep pace with things. It also helps with kind of smoothing out the RVU workload, so that if you're targeting, maybe you're targeting RADs to read between 50 and 70 RVUs in a day, you can keep everybody within a consistent range so that you don't have a wide disparity there. Other examples are the product actually has a feature called Auto Next, which will assign the next best exam to any particular RAD in a particular seat at a particular time. So for example, if I'm a neuroradiologist, my preference would be to read neuro exams. So the system will feed me neuro exams as they're available, and that's what I'm going to be spending most of my time on. But if I have any extra capacity, then it can serve up other exams based on other specialties or other preferences that I have, so that as a radiologist, I'm reading the exams that I'm best suited to read, and those exams aren't going to somebody else who's not as well suited to read those. So it really provides for clinical excellence and the radiologist ability to be subspecialized and provide better care. It also eliminates the RADs, quite frankly, from cherry picking the work list, because instead of, you can imagine in a group the size of Greensboro that's got 75 physicians, if everybody's hunting the work list trying to find the exams they want to read, well, they're going to kind of naturally cherry pick the good ones and leave the stuff that nobody wants to deal with. And then that has to get cleaned up at the end of the day. But if each RAD is getting, the right exam served up to them by the system, then they don't have to go look for it. They're just reading the next exam and the next exam, and it creates a great deal of efficiency for them. It also happens to be a great recruiting tool, because if you can show technology like this and the call center as well, it's something that a radiologist who's considering joining your organization, is going to be impressed with and say, wow, this is better than what I've seen in a lot of other places. Maybe I'd like to work here. There's also some great peer review and analytics modules built into the product. So these are some of the reasons that we like using a smart work list. I'd like to talk now about some of the benefits and just kind of the practical nature of this. What we've seen in the case of Cone and Greensboro Radiology is that by doing this workload balancing, we've been able to improve turnaround times. The ED and stat times have been improved by almost 4.5 minutes, and the outpatient turnaround times have been improved by 32 minutes, which is really significant. The inpatient times have actually gone up just a little bit, about 3%, but that's because the radiologists previously felt like they were having to work really fast and were kind of under duress to try to get everything done from the ED and the outpatient, and they wanted to spend a little bit more time in the inpatient world. And so this was by design. The radiologists were able to slow down a little bit and spend a little bit more time on those inpatient reads. So this is actually has provided some great benefits there. Overall, the improvement in turnaround times is 35 minutes and 25 seconds, which is significant for any radiology department. Laurie, if you can kind of walk us through what's happening inside of the system so that people can kind of visualize the work that's being done and how you can use the tools to accomplish it.
Sure. This slide actually shows the clerio screen that a RAD uses when he's reading or she is reading an exam. And communication notes are part of this. Communication notes are the primary communication mechanism that RADs use to communicate with the concierge team, and specifically the PRAs. The notes feature is integrated on this screen, and the icon is always available when a RAD is reading an exam. So they have the ability to quickly identify the type of assistance that is needed on that exam and choose a specific action from a drop-down selection. Some common action items could be critical results, call the report, there are missing images or a missing worksheet, and the RAD can request this just in 3 clicks. Once the RAD requests action on an exam, that action appears on a concierge Worklist dashboard, and that's what you see now. When a RAD creates that communication note, the note immediately appears on a shared dashboard, and this allows any available team member to promptly pick up the communication note. The Worklist setup is configurable to allow an organization to customize priorities based on their unique needs. And sub-work lists are also available, which are identified in the large red box, and they provide a hierarchy for communication notes. So in this example, stat cases appear at the top, and that's going to be pretty common. After that, non-urgent, followed by exam issues. This helps the PRAs prioritize their work and assure that they take timely action. This slide drills down to an example of a speak to provider non-urgent communication note. All requests and action are automatically time stamped by the system. And I think you'll find this with any Worklist system. It includes the username and time. So it's got a great ability to track what actually happened on that exam. This example also shows an attempted status, which identifies the time the note was actually picked up by a PRA. And it also lets other team members know who was working on the note, so there's no duplication of effort. When the communication note is completed, a completed status is created, and this removes the note from the dashboard. So it then frees up the PRA to take on another exam. Comprehensive reporting is available, and it's really important to be able to track turnaround time and completion times to assure the established standards are met, not only by the organization, but by individual staff members. With Clerio, we have an instant messaging application really built right in to Clerio, but we do have customers that use other instant messaging platforms as well. You know, on this screen, the PRAs are able to easily see a list of the radiologists who are working and if they are available or if they stepped away from their desk. So it shows if they're available or away. The PRAs and the RAD can exchange messages back and forth in real time. The PRA is able to identify the subspecialty of the RAD, and this feature also provides the ability to enter a phone number for each reading location. So an instant messaging platform is extremely important in your communication menu. We're also considering adding a new feature to our communication options, and that is a live chat feature. This feature would allow primarily text to submit a request through a chat option that would appear on their screen. It would eliminate the need for a phone call to the concierge service. And there are time-saving benefits to this. I mean, we could obtain up to a 75% decrease in the time spent by the requesters, which would be text. They would simply have to check boxes and submit. There's up to a 50% decrease in time spent by PRAs to handle calls. Instead, they would work the live chat requests. And this would be done all while maintaining expected resolution turnaround times.
Sounds great. As we've talked through the technology here and the benefits of using a smart work list, I'd like to quickly ask a question. Does your organization use smart work list technology? Either does the hospital have it in place, or does the radiology group have a smart work list system that they use? If you use the chat, just answer yes or no there, and we'd love to hear from you. So in the next section of our presentation, we want to talk about kind of the command center that really kind of sits behind the scenes, and it's really the power of this technology is the data that we have access to. And in our world, for our clients, we create what we call a RAD info portal. It's basically a centralized knowledge center with a repository of all kinds of information that is helpful to the RADs, the techs, the administrators, and the PRAs. So within this RAD info portal, and clearly you don't have one today, so you would have to build one. But once you build it, it's a rich source of information that really helps. In the RAD info portal, the PRAs can go here for everything they need. So they can find telephone numbers, various programs and help desk numbers, announcements, training materials, documentation that help them do their job better. We also have in here a database of all referring physicians. So in the case of Cone Health, there are more than 1,000 physicians that are connected to Cone Health, either employed or kind of in their extended network. So we had to get a database of all 1,000 plus physicians with their name, their specialty, the group they practice with, phone number, fax number, email address, etc. And that way, if the PRA needs to get a hold of a referring physician, they can get right to that person and don't have to hunt for that number or ask the radiologist to provide it. They can just immediately try to go get that referring physician on the line. We also have phone numbers into all the reading rooms and all the locations that the radiology group reads for, so that we can very quickly get to these numbers. And again, to Laurie's point earlier, there's only one phone number that anyone would use to call the radiology department. But there's a lot of phone numbers behind the scenes that the PRAs are using to facilitate this and make it look seamless. So they're answering the calls, but then they've got to make calls to various reading rooms or referring physician sites or catch a radiologist on his or her cell phone number. Those things are happening by the PRAs. But as far as the public is concerned, there's just one phone number. We're also able to put clinical policies in here and keep those current. So it's very important, we believe, to have a centralized knowledge center, a repository for all this information. So flash poll, do you have a centralized knowledge center with up-to-date contact numbers for every RAD and every location? Let us know your experience there. Just use the chat feature. And all of this is designed to improve quality, to ensure that the right radiologist reads the right study at the right time. So for example, if an orthopedic surgeon needs to get a hold of an MSK radiologist about a patient's exam, the orthopedic surgeon just calls the one phone number. It's answered usually on the first or second ring live by one of the PRAs. PRA will take the message, try to assess what it is that the orthopedic surgeon wants to know, and then we'll find out who's on shift and get straight to that MSK radiologist and get the two of them connected. So again, trying to get the right exam to the right RAD at the right time. So we've talked about kind of the what and the why and the how of the concierge service. Now we'd like to take a little bit of time to talk about the actual results. What kind of benefits is this proving by having a program like this in place? So we'll take you through a couple of the key metrics. And again, we're just highlighting one particular case study here. There are numbers of organizations that have programs like this in place, but we're just trying to kind of stay focused on the Greensboro and Cone example to give you a sense of what it can look like in one particular use case. So in their world, Cone Health has 83,000 calls a year that are being handled by the PRA service. Of those 83,000 calls, about 36,000 are inbound calls and 45,000 or so are outbound. The calls are answered live 98% of the time, and the average speed of response is 6.5 seconds. So usually the call is going to be answered by a live person on the first or second ring 24/7. The average call time is 2 minutes and 9 seconds, and that's time that the RADs aren't having to spend on the phone, but someone else is doing it for them. And the total time spent on handling calls is almost 3,000 hours per year that are being handled by the call center. When you take that 2,970 hours, it equates to 313 radiologist shifts if you assume a 9.5-hour shift. And that is the equivalent of 1.56 radiologists if you assume a RAD is reading or working 200 shifts per year. So the total efficiency gain in this use case is 2.1%. 2.1% of the time that the RADs are being freed up to focus on other things. And this is just the savings from phone calls alone, not counting the other benefits of the system. If we look at exam-related activities, we're actually handling 15,732 communication notes per year. The average length of time taken to perform that task is 11 minutes. So the total time is 304 RAD shifts, which equates to 1.5 radiologists. And if you think about it, a radiologist is probably your most important resource in the radiology department and your most expensive resource. So if we can free up 1.5 radiologists from exam-related activities and 1.56 from phone call activities, that's more than 3 radiologists that we are freeing up, or that you don't have to hire because these functions are being performed by administrative staff. So the net efficiency gain here is 2% for the exam-related activities. On the clerio side, just the technology itself, clerio typically provides efficiency gains in the range of 10%. Some practices have reported gains as high as 15%, but you really have to work at calibrating the system and continuing to refine it to get it to that 15% level. But generally speaking, 10% is a pretty fair indicator of the efficiency gains from using a smart work list. For the purposes of the concierge service, we just use a conservative estimate of 3%. So, while some practices claim much higher benefits there, we just use 3% as a conservative estimate here. And if we combine these numbers together, the 4.1% efficiency gain from calls and comm notes and the 3% gain from the smart work list totals a 7.1% net efficiency gain for the organization. That results in a little more than 40 minutes per 9.5-hour shift that are being freed up. If you work a 9-hour shift, it'd be closer to 38 or 39 minutes. So it's a very significant amount of a radiologist's day, and it's frankly the things that they probably enjoy doing the least and that are the most time consuming and tedious, where they'd rather be doing, really what they're paid to do. So this time that we're freeing up is very valuable. So those are some of the metrics for Greensboro and Cone. I'll quickly share with you a few other examples of organizations around the country that are using a concierge program. Some of these are clients of ours, some of them are not. Steward Medical Group is currently saving 97 hours per month on critical results reporting. They claim 11 minutes per report is being freed up. RIA, Radiology Imaging Associates in Florida, is saving 2.09 minutes per phone call. RIMA, Renaissance Imaging Medical Associates, based in Los Angeles, claims that their practice is now reading 10% more studies per day than they were previously by using a program like this. And Radiology Partners, which is a large private equity-backed radiology group, is handling 11 million exams per year through their concierge service, which they call the core team. So you can see some different examples here: a private equity-backed group, an outpatient imaging center group, a private radiology practice, and a national health system, all of them using a service like this and having great success with it. Now let's take a moment to talk about the budget considerations. Obviously, it's going to vary. The cost of a program like this are going to vary based on the size of your organization, what kind of volumes you have, how many radiologists you have, and the scope of the services. What things are we asking the call center team, the PRAs, to do? The more that you're asking them to do, the more that the cost will go up, but also the more things you're taking off the radiologist's plate. Another huge factor in cost is whether you're offering this during daytime hours only, or if it's a full 24/7, 365 operation. So assuming full 24/7, in our experience, the cost for putting in a program like this on a per study basis are going to range from about 50 cents to 95 cents based on the factors that I just mentioned. So that's a pretty good ballpark of what you might be looking at. But we believe the benefits and the return on investments are well worth the investment and more than pay for themselves. So now we'll talk about how to implement a program like this. We're happy to offer, we've kind of developed a playbook. We're happy to share what we have with anybody that's interested in doing this. Again, you can build a concierge program yourself, or you can outsource it. Obviously, we offer this as a service, but you can certainly do it without us. But we work with a number of different groups, and these are the steps that we've seen that lead to success with rolling the program out. First of all, obviously, you have to decide that this is something that you want to do. You've got to get budget approval for it, and obviously the hospital and the radiology group need to be in alignment in terms of what's happening and why we're doing it. Once you're ready to move forward, you need to assign a project manager that's going to build out the plan and kind of keep everybody on task, develop a charter or a statement of work, and then you've got to source out the right software and maybe hardware for what you're trying to do. So in addition to the Worklist products, you may be, you might need to purchase some scheduling software, maybe instant messaging, perhaps live chat, which Laurie mentioned. If you need hardware, you may need to add some workstations for this or remote reading stations. You obviously have to have your telephony right. So there's a number of factors that go into this on the software hardware side. We encourage you to provide a centralized phone number, one toll-free phone number. And then you have to determine the hours of coverage and how you're going to handle the nights and weekends with the service. And then once you've decided all these things, you'll need to recruit, hire, and train your PRAs. And if you need help or coaching on that, I'm sure Laurie would be happy to share kind of how she's done that with her team. A hugely important step here is to work with the radiology team to determine your workflows and protocols, because putting in systems like this and all of a sudden taking things off of the radiologist's plate is going to require some new thinking around your workflows and how you handle things. And this requires radiologist buy-in and sponsorship to make sure they're going to be happy with these changes. We also recommend that you build out that knowledge base that we talked about that we call Rad Info Portal. You can do that in a variety of ways. It can be done via SharePoint or Google Docs or an Access database. There's different ways to do this, but obviously it's got to be highly secured, and you only want to credential the right people who need to have access to that system, because there's a lot of important information in it. Within that system, you'll have to put in your shifts, your hours of coverage, your phone numbers, protocols. How do you handle things like code strokes, critical findings, what happens in certain downtimes, what are our SLAs, etc. These are all things that you're going to want to put in that knowledge center. And then once you have all this worked out, then it's just a lot of testing to make sure that everything is right before you go live. So that's just a few quick pointers in terms of how to implement a program like this. And overall, we believe that a concierge program like this requires a significant investment of time and money, but once it's running, it is going to provide huge benefits. And as I said earlier, it should pay for itself many times over. Most importantly, it's going to free your radiologist to focus up on the big rocks and allow them to be doctors first and foremost. And that's one of the things that we really love about this service. So that concludes our session today. I want to thank you guys for joining us for the session. We really appreciate your time. And as we mentioned at the beginning, we want to make this really interactive. So we're going to pause now to take some questions. Would invite you to use the chat feature to send us those questions. And Laurie and I are going to join our team in answering your questions live. And we'll just kind of take it offline and just answer questions until nobody has any questions left. If you do not have any questions and you don't wish to stay on, that's perfectly fine. You can end the session now. Before you do that, let me just leave you with our contact info, which is on the screen here. Feel free to contact me. Again, my name is Reed if you have any questions or would like any information about this. And also, we would invite you to complete the evaluation survey for this session. Let us know how we did. And you should be receiving a questionnaire from AHRA afterwards, asking you for your, kind of quizzing you on some of the things in here so that you can get your continuing education credits. So please remember to do those things as well. So thanks again. Again, we will open it up for questions, and I can see some questions coming in through the chat line now. So keep those coming, and then Laurie and I are going to try to field these questions, but we'll go ahead and close the session for now, and then we'll just be fielding the questions live for the next few minutes. So thanks again for joining us. Laurie, thank you for your time. Really appreciate you being here and for sharing your insights on this. And we appreciate all you guys' time and interest. Thanks very much, and have a great day.